Okay, so we're tackling this USUHS Medicine Clerkship Handbook.
Yeah.
You've got 10 weeks inpatient, outpatient.
It's
It's
a lot.
it's intense. We're here to like help you navigate it and make sure you're not just surviving but thriving.
Absolutely. And this handbook, it's super thorough, which is awesome, but it can be overwhelming.
Yeah,
So we're going to break it down, highlight what's really key, and what makes this clerkship different.
totally. And speaking of different, the first thing that I noticed
Yeah.
is that their motto is embrace complexity, act with simplicity, which I feel like that's good advice in general. But what does that even mean, like in the context of this clerkship?
Right. It really speaks to how USUHS approaches things.
Hmm.
They're not just throwing info at you, they're getting you ready for the realities of military medicine.
Okay.
You're going to face situations with a lot going on, maybe limited resources, and you need to make decisions
Yeah, that makes sense.
that are clear and direct.
It's like they're focusing on skills you can use and real-life experience,
Absolutely.
which is super valuable.
As you're going from student to doctor.
Totally.
And you see that in how the clerkship's set up.
Right.
Hands-on patient care, constant feedback. They want you learning by doing, not just by sitting in a lecture hall.
Yeah, no, for sure. And they actually give you a little preview in the what to expect section,
Yeah.
which is so helpful. It breaks down the 10 weeks inpatient, outpatient new faces you'll see. It's almost like a cheat sheet for your first day.
It is. And while we're on cheat sheets, have you noticed how much they talk about the RIAM framework?
A little bit.
Reporter, interpreter, manager, and educator. It's everywhere in this handbook.
Yeah, so it's not just what, it's
It's how you think like a doctor.
right.
Those essential skills.
Right. They're evaluating how you take in info, how you use it for patient care, how you even teach others.
Exactly.
It's a very like well-rounded approach.
It is.
And speaking of info, I love that they have a whole section on what do I need to know? I feel like that's like the #1 question
Oh, for sure.
students have when they're starting out.
It's so smart. Instead of just giving you this giant list of facts to memorize,
Right.
they give you a system to figure out what's important for any disease or therapy or test you come across.
Yeah, you're learning how to learn.
Yes.
It's not just for this rotation, it's for your whole career.
Exactly. And it goes deeper than that, too. They want you to get the what, but also the why.
Oh, okay.
So think about like how a disease works, how it looks in a patient, how it's treated, and get this, how it might affect a patient's ability to deploy.
Wow.
That's military medicine right there.
That's intense.
It is.
Yeah, it is. And it's not like they just throw you to the wolves and say, figure it out. They give you tools to actually like learn this stuff, right?
Exactly.
Like preceptor meetings, those are twice a week,
Yeah, those are
the
crucial.
whole time you're on the rotation.
That's where RIAM gets real. You've got this physician who's like your coach, helping you practice presenting cases, refining how you think clinically.
Yeah, it's like having a personal trainer for your doctor brain. And speaking of practice, those oral presentations twice a week, that sounds terrifying, but also amazing.
Right. It's like your practice run for when you have to explain things to real patients, concise and focused.
Oh, yeah. Gotta be on point. Okay, this next one I thought was super cool. They actually talk about AI,
Oh, yeah.
using AI in the clerkship for learning, even for patient care,
It's about time, right?
which is like cutting edge.
It is. But they're careful about it, too, emphasizing responsible use. So no patient info in the AI systems. Always run it by your preceptor for patient care and cite your sources.
You'd be ethical about it.
Exactly. This is the future, but we have to do it the right way.
And USCHS is like building those guidelines right in from the start, which is awesome.
It is.
But it's not all exams and AI.
Right.
There's a lot on professionalism in this handbook.
Oh, yeah, for sure. They're not just making doctors, they're making leaders.
Yeah.
Remember the educator part of RIME?
Right.
It's there. And they even give advice on things like giving and getting feedback, which is so important.
Oh, yeah, for sure. It's not just what you say, it's how you say it.
Exactly.
And they really care about how you're doing, like your well-being as a student.
Oh, absolutely.
Clear ways to report things if you're concerned, and just a big focus on having a support system. It's like they have your back.
Yeah, they do.
Okay, let's talk evaluation. Because this handbook lays out exactly how your grade breaks down,
Right.
which I always appreciate. Transparency is good.
For sure.
And it's not just about that NBME exam,
Yeah, that's important, of course.
but that clinical performance is a big chunk, like 80%.
It is. And they're looking for you to improve, especially in those last weeks.
So you got to bring it.
You do.
And they've got that DOLMEC, the Department of Medicine Education Committee.
Right. They make sure the grading is fair and consistent everywhere you go.
That's really good. Makes a big difference.
Huge.
Okay, let's actually get into the rotations themselves,
Yeah.
starting with the wards. Inpatient medicine.
The trenches.
This is where you, like, really learn by doing right.
Oh, yeah. Long hours, tough cases. But man, you learn so much.
Yeah, no kidding. And the handbook's clear about what they expect from you on the wards, especially those daily patient notes.
Yeah, those are crucial.
No cutting corners
No.
there.
They want originality detail. They want to see how you're thinking.
So it's more than just checking boxes.
Way more. It's about learning to approach patient care systematically, taking all that info, making it make sense, and communicating it clearly. That's being a reporter, an interpreter.
It all ties back in.
It does. And they give you some good guidelines, too, like the rules of 3 for writing everything up.
Oh, yeah, those are good.
It's all about being clear and concise, making every word count. And notice how much they emphasize the problem list. You're prioritizing being specific, and you need evidence for every diagnosis. It's all connected.
Yeah, you can't just say, I think it's this. You got to back it up.
Exactly.
And the daily patient assessments, too. You have to be on your game every single day.
That's where rhyme really shines. You're not just saying what you see. You're figuring out what it means. You're thinking critically. And even starting to come up with a plan, always with supervision, of course.
Right, you're not writing orders yet.
Yeah.
But they do mention observing and learning and even transcribing some with supervision.
Yeah, it's all about building up that confidence.
And for those who are like, bring on the intensity, they have a section on overnight call,
Oh, yeah.
which is optional but sounds like a whole other level.
It is. But they're realistic about it, too. Accommodations are, the call works with your team's schedule, and you're not working more than 24 hours straight.
Safety first.
Safety and education.
Okay, let's switch gears to the outpatient rotation. The clinics.
Okay.
Whole different pace, right?
Totally.
Mm.
But just as demanding, it's about getting good at gathering info, fast figuring out what's most important, and making good decisions. And you're often working one-on-one with attendings.
Oh, yeah.
So it's a great chance to learn from the best.
Like being in the big leagues.
Exactly.
And just like on the wards prep is key.
It is.
They really emphasize looking at charts beforehand, reading up on your patient's active problems.
So you're ready to make the most of that time.
No showing up cold.
No. You got to be on it. Ask
Right.
good questions. Really listen to your patients.
Be present.
Yes. And don't forget about following up.
Oh, yeah. It's not over when the patient leaves.
Exactly. You
Yeah.
might be chasing down test results, making phone calls, even doing some research to answer questions that came up. It's a continuous cycle.
Always learning.
Always.
It's like they're setting you up for your whole career, not just this one rotation.
It is about the long game, right?
Yeah.
They're giving you the foundation to be a great doctor wherever you end up.
Which is especially important in military medicine. And they don't shy away from that at all. They actually highlight the unique things about it, the opportunities and the challenges.
Absolutely. From the patients you'll see who are coming from all walks of life
Yeah.
to deployments, this clerkship shows you stuff you wouldn't see anywhere else.
It's like they're preparing you for anything.
Because in military medicine, you kind of have to be ready for anything.
Right. And that brings us back to that line from the beginning. Embrace complexity, act with simplicity. It really fits this whole clerkship.
It does. And it's not even just about the medical stuff. It's about navigating the whole system, being an advocate for your patients, being a leader.
Yeah, they talk a lot about leadership, especially when it comes to professionalism.
It's the core of what we do as doctors.
For sure.
Those values, integrity, compassion, respect, owning your actions. It's everything.
And they have a whole section on it. Communication, teamwork, giving and receiving feedback. Well, like a crash course in being not just a good doctor, but a good person.
Exactly. And a big part of that is knowing yourself.
Yeah.
They're big on recognizing that you can't pour from an empty cup. Taking care of yourself physically, emotionally, mentally, it's not selfish, it's essential.
You can't be there for your patients if you're totally burned out.
Exactly. And they get that. They're serious about making a safe and supportive environment where you can actually thrive.
And they mean it too. They have clear ways to report things if you see something wrong, like mistreatment, unprofessional behavior. You can even do it anonymously.
It's about looking out for each other.
They've got your back.
They do.
So to kind of wrap it all up,
Right.
it seems like they're really trying to help you succeed in every way.
It's that holistic view again. Being a good doctor isn't just about what's in your brain. It's about who you are, how you handle pressure, your dedication to doing what's right.
Well said. So as you're getting ready for those 10 intense weeks, remember what we talked about.
It's going to be a lot, but you're ready.
Be ready to work hard, to be challenged to learn and grow. It's a wild ride, but you signed up for it.
You did, and you're going to crush it.
Embrace the complexity, lean on your team, ask for help when you need it.
And never forget why you're doing this. to care for your patients with everything you've got.
Couldn't have said it better myself. Go out there and make us proud.
This is just the beginning.
And remember, if you ever feel lost, the Deep Dive is here to help guide you through. Until next time.